Awesome. Thanks everyone for joining us for the Innovator Pitch session, and to those of you who were a part of our conversation for the last hour and a half. We're super excited to hear from our winning teams. I'm just going to take a second to introduce the teams themselves, and also, there we go, introduce our experts who will be joining us for the pitch session today. So first off, just want to say a huge congratulations to all of the teams that were selected in the Global South Health and Livelihoods Innovation Challenge. As you heard in the last session, there were over 600 submissions to the challenge across 3 weeks of time from over 71 countries around the world. And so the innovators who you're about to hear from today represent 10 of the strongest, highest potential concepts that were submitted to this initiative. And they also represent a geographic breadth all over the Global South, from Latin America to the African continent. So I just love to take a minute to honor these faces that you'll hear from today. Yeah, feel free to send them some love in the chat, give some shout outs if you know any of the teams that are presenting, and congratulate them on the journey that they've been on up until today. Great. So with that, I want to introduce our experts who are going to be offering feedback to the teams after they share their pitches with the audience. The experts feedback verbally with the teams, and everyone in the audience, we'd love for you to share feedback, thoughts, reflections in the chat, and those will be collected and shared with our pitching teams at the end of the session. So our first expert is Hector Portale. He is the leader of Movimiento in Latin America, an initiative of Roche. Hector has worked in social initiatives within healthcare and public agreements in Latin America, Europe, Chile, Argentina, Brazil, and Italy, with a particular focus on treatment humanization initiatives for childhood in Brazil and reconstruction efforts after Chile's 2011 earthquake. He's currently focused on building scalable impact solutions for healthcare systems in Latin America. Welcome, Hector, and thanks for being with us. Our second expert, if you joined our last, our second expert, if you joined our last conversation, you have learned about her already, but is Mariela Campos. She's a political scientist by training, based in Peru. She leads the anti-COVID-19 efforts for La Victoria Lab, the partner for this initiative, and Intercorp's innovation arm. Before that, she was deputy political editor at El Comercio, the most published newspaper in Peru. Mariela, thanks for being with us.
Hi again.
Our third expert is Luisa Covario. Luisa is an interaction designer by training and an activist at heart. She spent the past decade working with communities and organizations to create the conditions for radical collaboration, movement building, and social change. Before joining OpenIDEO, Luisa started a social venture to facilitate knowledge sharing between social entrepreneurs and develop participatory design programs engaging marginalized communities from New York City to Beijing. She currently serves as senior director at OpenIDEO. Great. And in a few minutes, we hope we'll be joined by our fourth expert who's going to offer feedback, Luis Silimingras. He's the managing director at IDEO London and leads the relationship with Intercorp and La Victoria Lab, influencing thousands of families across Latin America through design and innovation. Thanks everyone for joining us. We're excited to hear your feedback on all of our pitches and share your expertise with our innovator teams. Great. So with that, I'm going to pass it off to Isaac Jumba, who's been an integral component of the challenge itself and working with our innovator teams. Isaac's going to be walking us through the rules of engagement, and then he's going to introduce our team's pitches. I'll pass it off to you, Isaac.
Amazing. Hi, everyone. My name is Isaac, and I'm really excited to be joining. So yeah, just to set a bit of rules of engagement. First, we are really excited to have all of you join. We hope the break was amazing for each one of you and you are excited to start off on the next bit. So as we have shared before, each of the teams will have 3 minutes to take on stage and share the ideas. Would love to encourage for you to use the chat to share your feedback, share your thoughts, ask any clarifying thoughts. as well as suggest any resources that you might have. We also want to encourage you to have fun, listen in, and really have a good moment as well. Also, all the experts, each innovator will receive feedback from all the experts that are going to be there, and the rest of the experts will also be providing feedback on the chat as well. So now, without further ado, I'd love for us to take a deep breath. Make sure you have your smile on, you have excitement, and at this moment, I'd love for us to invite our first innovator on stage. So the first innovator going on stage is Mahin, all the way from Pakistan. So over to you, Mahin.
Hi everyone, my name is Mahin Dhanani, representing Doctors from Karachi, Pakistan. Next slide, please. I'd like to begin by telling you a story about 3 women who have impacted our lives. The first is Lila. She's a doctor by profession, and although Lila graduated class, her husband works full-time, and she's unable to leave her 3 children unattended. Next to Lila is Sophia, a 25-year-old nurse. Despite being trained by the government as a lady health worker, Sophia remains unemployed because there aren't many employment opportunities in the urban. Finally, meet Nadia. Nadia is 2 months pregnant. She's in a factory, and Nadia is struggling to seek care for her frequent pelvic pains. Now, in order for Nadia to see a specialist, she needs to exit the factory, sacrifice her daily wage, and even worse, in the COVID-19 crisis, she isn't at the end of the day. So there are over 300,000 female health professionals who are excluded from the global health workforce, large childcare obligations, unsafe or sociocultural barriers. At Doctors, we use technology to connect these women to their full potential. Next slide, please. Vida Nueva Americas will offer secure access to health services via either home health services or pharmacy-equipped smart clinics in factories, both conducted by technology-enabled promotoras, connect communities and health seekers from the comfort of their homes or workplaces to a remotely located regional network of female doctors for consultations using telemedicine. Now, we have been enabling a lot of women since before COVID-19, and now even more due to restricted working conditions. We are already scaling on with over 75,000 paid customers, and because of the remarkable similarities in cultures, social architectures, and multinational corporate partners, we strongly believe that this model can be replicated in Latin America, starting off in Peru, in collaboration with local innovators and Peruvian companies. Now, just imagine the social impact we can create together if we can empower 4 million factory workers and the underserved populations in Latin America. Then the Nadias, the Lilas, Sophias of the world can then go on to transform their own communities, creating progressive social change that will last for many generations. Thank you.
Awesome. Thank you so much, Mahin.
There's another slide after this.
Awesome. So thank you so much, Mahin, for starting us off.
Thank you.
We'll be hearing your feedback directly from Hector, and then the rest of the experts, feel free to put your feedback on the chat as well, and the rest of the attendees joining us as well. Okay, I'm not sure if Hector was able to hear us, but I'll also welcome any feedback from any of the expert members we have on the call.
Good, thank you. I had some connectivity issues that have been solved already. So fantastic presentation, Rahim, of the impact that you intend to bring to populations. My first question is, how do you intend to articulate the whole chain from the providers that you have assessed with the local informatic systems that you need to have in the local structure, in the areas, specifically in Peru, as you mentioned, together with the local understanding and expertise required to provide local guidance on medical and pharmaceutical issues?
That's a great question, Hector. Yes, exactly. So we are already partnered with many multinational companies that have a global footprint and are also present in. So we hope to continue our project collaborating with them in Latin America, and then also partner with additional companies, for example, telecom companies, to further enable our project.
Thank you. I'm curious, I appreciate as well how in your canvas, it seems that you have a purpose as well of serving a specific community with the profile of the doctors that you intend to provide the service. That's wonderful. Now, when it comes to COVID situations where, everyone trying to provide a solution to COVID is an entrepreneur because that's something that is novel worldwide, we are finding that similar services have obstacles on providing, on the usage, given that some populations are perhaps afraid of reporting symptoms due to, going to locage or things like that. How do you plan to tackle the accessibility, the willingness to use the platform in this current COVID context?
So these promotoras that will go to their communities and visit health seekers in either their homes or their workplaces, first of all, we will pick these promotoras from local communities, and they will be serving their communities themselves. This in the communities because they will already know them, and they will also be using a smart device connected via 4G Wi-Fi services to the remotely located doctors. So it's very unlike visiting a large hospital or a clinic.
Awesome. Thank you so much, Mahin, for that feedback as well. I think more feedback can be relayed on the chat, and also any other questions or resources that anyone else would love to provide. Next up, we'll be hearing all the way from Guatemala, and we'll be listening from Victor. So Victor, feel free to start.
Hi, good morning here for many of us. So hi, my name is Victor Juarez, and I represent the Consejería in Guatemala. And I don't know about you, but I don't like to meet someone and see him, her not feeling good. I'm inclined to ask them all the time how they. So all my professional life, I've worked with youth, and this happened a lot, me asking them how they feel. It showed me that we have a problem here, a lot of problems actually, bullying, violence against women, use of substances. So how can we do it? Mental health is a privilege in many countries, Guatemala being one of them. And many people have never had help from any professional before. And we are changing that. Technology allows us to reach them in a confidential way, which is very important with the stigma around asking for help. Our chat service allows youth, especially, to afford a professional advice, counseling, and even therapy from anywhere at any time. So we want to close the gap of attention and reach as many youth and women as possible, educating them with the importance of mental health using different channels, such as social media, virtual and in-person events. And please change the, the slide. I'm excited about one event that we are particularly going to have in November about vocational training and different information. So with this type of materials, but mainly be ready to help them when they need it the most. So we see now that we're making this a reality. Next slide, please. Most of our users are women. Most of them are young, And above all, we are giving them the opportunity to ask for professional help whenever they need it. Next slide. We're now also facing a first time in 100 years event. Facing a pandemic is something that none of us expected a few months ago, and it's reshaping the way we live. So, and of course, forces us to start thinking about our mental health. Health should not be a privilege anymore, and we need resilient and happy people all over the world. Next slide, please. We are starting in Central America, but don't you want to be surrounded by happy, resilient people everywhere you go? Help us spread the word and let us help more youth and women all over the world. Thank you.
Thank you so much, Victor, for sharing with us that. I think in the next 3 minutes, we'll hear feedback from Marielle with regards to your pitch.
Hi, Victor. Thank you so much for your pitch. I just have one main concern. How sustainable is it to scale this initiative? Because as far as I know, you need psychologists in the other end of the application. So how sustainable is it to have many psychologists working for the application as the clients increases?
Yeah, of course, and this is sort of my favorite part of our business model, is that we pretty much function like a call center. So it's the same dynamic. So we can have, and that's sort of the secret sauce of all this model, is that we are, the good thing about a chat service is that we can be helping more than one people at a time, instead of a therapy like is one-on-one. So any of our psychologists have the opportunity, or they are working with at least 3 or 4 people at the same time. So that allows us to grow in terms of users being helped. And at the same time, we will have to, of course, as you were saying, needing the many psychologists in each of the countries that we would like to start offering the service. In Guatemala right now, we have 11 psychologists working with us. And the idea, of course, is to, as soon as we have more users, we can start hiring more psychologists. So I think that one of the main parts, and this is another thing that I love about our model, is that we are giving jobs to these particular professionals that are sometimes, at least in this country and in the region, they are working in other fields instead of what they studied for. So we really want to help them as well. So there's a lot of twists that we might do in the future, but the main goal right now for us is to have as many users as possible, and especially users that have never had the access to mental health. So yeah, that's sort of the idea.
And just one last question. What's your strategy to actually get more users?
Well, if you see the statistics, many of the people that have access to mental health is sort of the top of the pyramid. So we're talking about millions of people just in Central America. And with the stigma around asking for help, all our plan is to just share the message that we are there to help them and not necessarily because psychology is the word that sometimes creates this stigma. But if we're there just to give counseling or other topics, and that's why our name in Spanish is like that, like counseling, because we want to be there all the time, whenever. And many of our conversations right now start with just a little hi. And we know that that's the trigger to be there and help them. So some of the users spend like 30 minutes speaking about anything else but their problems. So after creating this trust, we know that we can help them. So that's why I mentioned quickly that we are creating all events and different other type of ways to reach them, because they are just, and we're completely positive, all our team, that it's just a matter of being there when they need it the most.
Thank you so much, Victor, for that amazing also question and answer. Feel free to respond to some of the questions that come in on the chat. So next, we will be listening from an innovator all the way from Bolivia. So let's welcome Lady.
Hi, everybody. Next, please. Next, please. Thank you. Doña Lidia is a vegetable seller who day by day wake up early to buy products nearby farmers and resell them through her stall in a small market in La Paz. Next, please. She earned just enough money to sustain her family. During the past few months, she has seen her neighbors die as a result of COVID-19. Next, please. She knows she's a risk, but she must work. She is worried about her health, but she doesn't have enough income to go to a doctor. Next, please. Doña Lidia reality is the same for most informal workers. Next, please. Next, who represent 50% of Latin American jobs. To help them, we have developed VitalSen. VitalSen is an IoT system that monitors and performs an evolutionary monitoring of 3 vital signs. Next, please. Temperature. Next, oxygen saturation. Next, heart rate for many users in real time. Next, please. To benefit Doña Lidia and other informal workers, we need to place a VitalSen monitoring station in her farmer's market, where each worker must use VitalSen station every day, about 5 minutes. Next, please. System collects data and stores them in a cloud server, where analyze them in real time, looking for abnormal patterns. With COVID-19 scenario, people such as Doña Lidia, who cannot afford a PCR test or go to a doctor constantly, VitalSen will help to detect in early stage possible complications like pneumonia. This will allow Doña Lidia to take right actions at the right time. In addition, VitalSen collects health history records for each user, which in the future could also be shared with a medical staff if needed. Next, please. Next, we have developed a portable version which is being tested with 3 families. Next, please. Our next step is to build a run pilot of VitalSen station, placing it in a small market in La Paz in order to get user feedback and detect possible failures. Next, please. After that phase, we want to install VitalSen station in many markets in La Paz. The solution will be offered as a monthly subscription, which will cost $2 per month. Next, please. To each informal worker. This price covers daily monitoring and monthly historic reports to our users. Next, please. Initial development will be done on 60 markets, which will require an initial investment of $10K USD. Next, please. Which, according to our business model, it has a 6-month return. Next, please. We invite you to join us in helping vulnerable people with basic management of their health. Thank you.
Thank you so much, Lady, for taking us through that. A big appreciation for that. Just to remind us, as the innovations go on, please feel free to leave your feedback, your questions, resources that you might have on the chat, and the innovators will be ready to respond after they pitch. So we'll be hearing feedback from Luis with regards to Lady's pitch.
Lady, thanks so much for such a great presentation. We've been very impressed by how human-centered this solution is. Can you go a little deeper on the business model? You're saying that the cost per unit is $154. Who pays for it, and what are the revenue streams that you expect come 6 months after launch?
Okay, thank you for the question. As I mentioned in the pitch, who is going to pay for $2? It must be the informal workers, because trying to get a kind of money from government or something like that, is decided to put this amount of money in order they could be affordable for informal workers. Being honest, $2 in my country represent just, for example, 3 travels on bus. So we set this money in order they could be affordable for them. Our revenue streams are going to be this money that comes from the subscription model. We have been thinking, as mentioned in the as I mentioned in the pitch, each market has around 30 sellers inside. So if we put one VitalSen station, the only thing that we must do is multiply $2 per 30, which is going to be our mensual revenue for each market.
That's great, lady. Thank you so much. What are, as you're rolling out, what are some of the main barriers that you expect, and how do you plan to overcome them?
Okay, this is an amazing question because in Bolivia, also in most Latin American countries that we have informal places to sell things, we need to be sure that the place our Vital Station is going to be must be very take care. We must take care it from maybe sellers or this kind of stuff, because markets are not a kind of very safe place. So I guess this is going to be a very big challenge. Try to find a place and try to talk with the sellers in order that they must to take care that stuff that is going to be useful for them. And the other thing that is very important, but is more technical, I guess, is trying to be sure that the data we're collecting are reliable. We have been working very hard during the last month in the engineering of the project, so we we need to ensure that these data all the time are going to be reliable. We plan to check this station once a month, for example, in order to be sure that our sensors are collecting the right data.
Awesome. Thank you so much, Lady, for that, and also Luisa for those amazing questions. I hope the conversation will continue on the chat. So next up, we will be hearing from Osvaldo, all the way from Peru. So Osvaldo, please feel free to start.
Hi, my name is Osvaldo Nomura, and today I'm presenting on behalf of Gamarra Clicks team from Lima, Peru. I'm going to ask you to picture yourself working for more than 20 years, building your own company, your brand, and learning everything you need to know about the clothing industry, only to discover that you will probably run out of business by the end of this year. And now, with the help of your kids, you are opening social media accounts to try and get some sales. This is the case of Flora Banto. You can see her in the picture. She's one of our partners and one of the more than 33,000 entrepreneurs in the Gamarra ecosystem. Gamarra is the biggest garment manufacturing hub in the region, selling almost $2 billion yearly and reaching countries such as Ecuador, Brazil, Bolivia. Yet, the only sales channels are small packed-together brick-and-mortar stores, where more than 700,000 people could pack their streets in peak days. Something impossible to do with COVID-19 still around. So now Flor has found herself in the urgent need to find new customers and new ways to sell. And this is where Gamarra Clicks comes in. We started as a marketplace where entrepreneurs from Gamarra could showcase and sell their clothes to millions of users in Peru. Well, a simple idea, right? But in this process, we learned we had lots of space for improvement because they needed way more than just a marketplace. First, they needed to develop their brands in order to compete online. So we reframe our approach, assisting them in this process and getting around the challenges that digitalization in COVID times involve. We are a multidisciplinary team, including retail, e-commerce, digital marketing, and design thinking specialists. And using our background, we put together a free weekly workshop called La Hora del Socio, where we share everything from photography tips, social media management, inventory management, and even tax and formalization strategies. Gamarra Click then became more than an online market. Now we're talking about social and digital inclusion. Next slide, please. We believe in the resilience of the Peruvian entrepreneurs. Currently, we are working with Flor from Crios Felices, Eric, Joel, and 60 other partners. Our targets are to double that number by the end of this year and become the go-to place for Gamarra in this Christmas campaign. However, our vision is to refine our digital methods and generate the right partnerships in education, government, and tech, and build this platform for more than 33,000 entrepreneurs in the Gamarra ecosystem, helping businesses strive and helping clients diminish COVID-19 exposure. So we ask ourselves every day this, and now we're asking you, where could Gamarra be in the next few years with the right tools and right support? Thank you. I got a next slide also.
Thank you so much, Osvaldo, for that amazing presentation. We'll be hearing verbal feedback from Hector, who will be sharing in the next 3 minutes or so. So, Hector, once you're ready.
Excellent. Thank you, Osvaldo. It sounds an amazing and promising initiative, especially considering how you can leverage over, the national Peruvian international expertise on items like cuisine, and how the local craftsmanship may leverage on some global assets that you can work upon. Now, my question is, how are you looking for a specific target population, and which one is that target population, considering the vast variety of providers to the Gamarra Click website?
Well, we as a Gamarra Click have two clients. We have the entrepreneurs in Gamarra, that's the ecosystem that I talk about, and then the platform, the online market. We have another client that are, well, we were surprised because at first we thought we were targeting Gamarra, the people that went to Gamarra to buy clothes, and then we understood we were getting much younger and digitalized customers to buy the clothes. So yes, I don't know if you.
Right, exactly. That's the focus that you may be achieving. May be focusing on replacing your current customer network, but you still may find ways by training your former clients to channel their former consumption habits through the local Gamarra website. So are you thinking on retraining as well the former customers of Gamarra local producers?
Yes, of course. We also think we can scale to people that buy in bulk, because that's also something that Gamarra does right now. That's actually the strongest part of Gamarra. So we're focusing right now in the end customer, but we think we can target that bulk customer too. So sell to provinces in Peru and also reach other countries. So yes, we think we can do it.
Last question: how you plan to do that?
Well, we as a company started we have social media accounts and also our webpage where we share what we're doing, so people can get and buy from Gamarra from their houses. Yes, we try to say like train our customers, but yes.
Awesome. Thank you so much, Hector, as well as Osvaldo, for taking us through that. Cool. So next up, we're gonna be hearing from Claudia, who will be taking us through her innovation. So feel free to start.
49% of Peruvian families do not have access to refrigeration, either because they can't afford or because they don't have electricity at home. This means that during the current pandemic, these families have to go every day to the crowded markets to buy food such as rice, noodles, and canned food. They don't buy fruits and vegetables because they have nowhere to refrigerate them. Hi, we're Kulka, a simple technology that transforms lives, and we want to change the situation. Next, please. Our goal is to democratize access to food refrigeration by providing low-income families an artisanal refrigerator that runs without electricity. We want to change two behaviors: people not leaving their homes frequently because they have a place to preserve food, and encourage them to consume fruits and vegetables to have a more balanced and healthy diet. Next, please. But how it works? Kulka is composed by a large container that holds 3 small containers where the food is placed. All of the containers are made of clay. The space between the containers is filled with sun. This is because Kulka uses the process of evaporative cooling. When water is poured in the sun retains it. And as the water evaporates from the clay surface, it cools the interior, enabling to store up to 15 kilograms of fruit, meat, vegetables, and more. According to research, by using this technique, on average, the duration of fresh food is doubled. Next, please. In our B2C model, we'll sell directly to people over basic and premium lines. The basic line is aimed at low-income families, and the principal customers are the housewives. The basic line has a cost price of approximately $30 and will be sold at $40. A big difference with the $150 on average that a small refrigerator costs. To grow, we plan to turn our early adopters into Kulka ambassadors so they can spread the word about the product. The premium line is aimed at upper classes. They will be able to customize their Kulka based on their preferences. For every premium Kulka sold, we will donate a basic one. In our B2B model, we plan to sell a basic line to companies and organizations that seek to generate a high impact on low-income families through their social responsibility programs. Next, please. Kulka will provide quality of life to low-income families because it will allow them to have a healthy and balanced diet, and they will be less exposed to the virus. Also, Kulka is eco-friendly because it works without electricity, and it's 4 times cheaper than a small refrigerator. Through Kulka, we also generate employment for small artisans who are struggling because of the current situation. To make this happen, we would like to come with partners because we believe that together we can shape the Peru's future. We invite you to join us in the eco revolution. Thank you.
Claudia, for taking us through that amazing presentation. We'll be hearing from Marielle about your feedback with regards to your pitch.
Thank you, Isaac. Hi, Claudia. Well, to be honest, I love this idea. I think it's great, and it solved like a pressing issue in Peru that was in part responsible for the peak of COVID-19 that we had around July. But I have 2 questions. First, how would you solve, I mean, this is still a prototype, right? So how would you solve the issue of mass producing this product? I mean, what do you need in order to produce 1,000 or 100,000 of these Kulka refrigerators?
Okay, thanks for the question. We think we would like to start working with artisans because we know we could approach there to other problem also, the lack of work for them. But maybe for the mass production, we could have like these master artisans that could guide the process and maybe have more bigger infrastructure, like a bigger I don't know how to say it exactly, but like to do it in a faster way, like not maybe so artisanal, but count with the artisans as the master, the chief, the bosses of the process, the ones who guide the process to producing mass these Kulkas.
Okay, and my second question is, I know I have some inside information that this is an initiative that you and your brother started. So I wanted to know if you have put any thought in like a human resource perspective of how many people do you need, or how is this organization works in your mind in order to make it past the prototype stage into a production stage in the future?
Yeah, right now, yeah, we are forming the team with my brother and I, but also 2 more industrial designers also that help us. They're part of the team. Right now, we think that we would like to, of course, to run the pilot. For example, we would like to count with contacts to be able also to do it, to run the pilot, start producing in mass. We do think we would like to have a collaboration with other companies, with other people. We are open to that. And yeah, especially, I don't know, mentors for this part of the process. We would like a lot of that, because it's like the first entrepreneurship journey that we're having. So we would really like to have mentorship and connections and maybe networking, and also, of course, investment. It's important also to start this. So yeah, all those things.
Amazing. Thank you so much, Claudia, for that amazing presentation, and as well as feedback from Ariel. So we want you to just take a 10-second stretch. Make sure you're still here, make sure you're still present, and please let us know on the chat how the pitches are going. And yeah, so I think as you do that, just let us know how the pitches are going. Make sure you stretch, make sure you have a deep breath, make sure you're really present and you're enjoying the sessions. So next up, we'll be hearing from Abhi, all the way from India.
Am I audible?
Yes, perfect.
The best way to contain the COVID-19 outbreak is isolation. Isolating people in slum is even more difficult. And it gets more difficult when 6 to 8 people share a home which is only 300 square feet. Good morning, everyone. I am Abhimanyu Singh, co-founder of Team Expressions. I am from India, and we are a small team of designers who believe disruptive design ideas can change the society. And I'm happy to share our latest innovation, which is honeycomb isolation beds. Next. India has only one bed for every 2,000 people. And this acute shortage of isolation beds pushed us to design ready to assemble fast, modular, and sustainable isolation bed for COVID-19 patients. These are made up of recycled paper honeycomb panels. The best USP of recycled paper honeycomb panel is the COVID-19 virus can stay only 24 hours on this material, which is least among all the materials. So basically, it's an isolation bed, back slide only. It's an isolation bed which can be assembled within 2 minutes with the help of only 2 people. And the USPs are, it is super lightweight. The overall package weight is only 10 kgs. It can take up to 300 kilos of weight. It is 100% biodegradable. It is coated with silver nano coating, which is for disinfectant. It's a flat pack design, and it is water resistant. As you can see in the image below, these isolation beds are equipped with an outer cover, which has a medical tray, food tray, cloth tray, and a LED light. The general time of a COVID-19 patient to treat is 2 weeks, and those 2 weeks, they will need all these facilities. That's why we have included all these things in this. And the cost of this bed is only $49. And we have a renting model also. Next, please. Our customers are NGOs, hospitals who want to quickly create these isolation facilities, quarantine facilities, and healthcare camps. But our innovation goes beyond this crisis. Once the COVID outbreak is over, we will be supplying these beds to hospitals who cannot afford those expensive hospital beds, and to slums where people cannot afford a bed to sleep. And we have already installed over 100 beds locally in India for COVID care center. And we would love to scale this globally. And we need your help to take this idea forward. Thank you so much.
For that amazing presentation and a strong finish. So I will invite Luis, and Luis, I'll just give you about 2 minutes to be able to share any feedback or any question you might have.
Hi, Abhimanyu, and thank you very much for your very interesting presentation. How are you planning? I mean, obviously, if you would be successful with this, you would have a massive demand. I mean, how would you think? Have you thought about scaling this idea? What's your plan in that respect?
So paper honeycomb is basically used for packaging industry, and there are a huge network of packaging manufacturers who make honeycomb. And we have identified it over Asia that there are so many manufacturers who can supply us these panels. And these are simple methods. We just need a die cutting machine and honeycomb panels. So wherever we want to scale up, let's say we want to go to the next country, we can find a local manufacturer, make the dye, and make it there only.
And why, I mean, if this seems like an idea and there's a market for this, why do you need us? Why do you need our support to do this? Why are you not already doing it?
So I think getting the market access locally to other countries where we don't have any network, we really want you guys to propose this, but because promote us as a designers, as a company who is making it, because we do not have links in the other parts of the country. Like say Latin America, we have no links. So if we get introduced to the right partners, right stakeholders, it will be really easy for us to take this idea forward.
Amazing.
How many have you installed already?
It's 100 plus.
Thank you very much.
Thank you. Thank you, Louis.
Thank you so much, Luis, and thank you so much, Abby, for the amazing presentation. For the rest of the questions and conversations, please let's use the chat. So next up, we'll be hearing from Abigail, all the way from Nigeria.
Hi, my name is Abigail. I'm the team lead for Store Refill, a digital platform connecting manufacturers directly to small retail businesses in Africa. Next slide, please. Next slide. Zainab, a friend of mine, is one of the millions who run small retail businesses in Nigeria. She sells dairy products, toiletries, and other things in her small outlets located in Oshodi area of Lagos State. She's the mother of 4, and the lives of her family members completely depends on the small business she managed. In late February 2020, when the Nigerian authorities locked down the cities across the country to curb the spread of COVID-19, Zainab feared her small shop would quickly go out of stock as she couldn't travel to the markets to get everything she needed to stock. This is a very difficult situation for her because there's no other means for her to get everything she needed. This brought about the existence of Store Refill. We bridged the supply chain gap. With just a call or SMS to our center, Zainab could get everything she needed within a short period of time without leaving her location or exposing herself to the danger of COVID. Till date, next slide, please. Till date, we have positively impacted over 1,000 retailers like Zainab, and we have successfully fulfilled over 100,000 orders. And looking forward, we aim to spread across other communities to impact more lives. And we are calling on investors and other people from other sectors in joining us in this journey of making the world a better place for people to live. Because we believe the beauty of life is not how happy you are, but how happy others can be because of you. Thank you.
Amazing. Thank you so much, Abigail, for that. So we'll be having Hector just take a maximum of 2 minutes for providing feedback to your pitch.
Abigail, then, fantastic. It's consolidated with the precedent that you have shown. Now, my question is, which is your expansion plan, and how critical link with the logistics provider for that expansion plan?
Yeah, just like I said, we partner with manufacturers directly. So by buying everything we needed, our clients needed from them, we supply our clients everything they ordered for. So this makes it easier on the part of the retailers to gain more profit on the things they sell, because we get it directly from the manufacturers by bridging the gap of supply chain. So that is exactly how we do it. So we have our logistic plan by having buses to get these things to the small retailers in their locations. Did I answer your question?
I was looking more, Abigail, on your expansion plan. If you are looking to impact beyond Africa and globally, how are you going to find those truck partners, logistical partners?
So that is why we are partnering with people across different sectors, so that to make it easier for us to reach other community in across Africa. So if you are able to partner with investors and people from across other sectors beyond Africa or outside Africa, this will definitely be easy for us to do because we are already running it. So it will be easier for us to also run in other parts of the world.
Awesome. Thank you so much, Hector, as well as Abigail, for providing that. Just sort of sharing out that we are running a bit over time. So I think for the next remaining features, we'll try to keep the feedback as short as you can. Then we'll have the networking rooms afterwards to really dive deeper and interact with the innovators and any of the other attendees that might have additional questions. So thank you so much, Abigail, as well as Hector. So next up, we'll be hearing from Sebastian. So if you're ready, please take the stage.
Hi, can you hear me?
Perfect.
Great. Good morning, good afternoon, great to be here with you. Latin Americans are now returning to their daily activities following some of the longest and most restrictive lockdowns during the COVID-19 pandemic. As workplaces adjust to the new normal, employers are setting up protocols for staff to minimize the risk of infection while going back to work. But how about the 140 million Latin Americans who work informally? The small shopkeepers, the domestic workers, the individuals who sell items on the street. 50% of workers in the region do not have a formal work contract. How are they going to stay safe as they return to their day-to-day activities? I'm Sebastian Chaskel, and during the past months, I have been part of a group of Latin Americans from different backgrounds who have developed a tool to support those working informally to stay safe. Next slide, please. Today, I am excited to share with you BioSeguro, a chat service currently available on Facebook Messenger and soon via text and WhatsApp. When you text BioSeguro, initially, a bot will ask you what you are planning to do this week. Once you share how you spend your time, BioSeguro sends you general guidance on how to stay safe that comes from the government, the WHO, and other reliable sources. It will then ask you how you move around and can give you advice on how to stay safe while getting to work. If you ask questions that go beyond the bot's capacities, you are rerouted to a person. Next slide, please. We ran a small pilot using Facebook ads in Colombia and chatted with about a dozen potential users. The bot does not offer great advice yet, but the experience allowed us to understand the types of questions informal workers have and to develop the bot further. BioSeguro mimics the type of interaction individuals are familiar with, but allows users to be anonymous and ask away. And while friends unfortunately may return missing, we return accurate information. Thinking past COVID-19, BioSeguro may become a central node of information for individuals outside of formal safety nets. We could provide information on how to access government services or products, such as insurance. We see this as the path to sustainability. What's next for us? A team of us has put time into developing and testing the service and programming the bot so far. But while we are passionate about the idea and have put in many late hours into it, by ourselves, we do not have the bandwidth to develop it as quickly as would be necessary to make it a useful response to the pandemic. Therefore, at this point, we are seeking input as well as team members to make BioSeguro a reality. Thank you.
Sebastian, nothing to add to that. So I'll invite Marielle just to do a quick feedback, and then, yeah, we'll have more time later.
Okay. Thank you so much, Sebastian. I have one reaction, like very quick. I think that the brand of BioSeguro makes me think of insurance instead of COVID information. So maybe you should like test it and see if other people are having the same reaction. And then I have two questions that are linked. The first, is there a market? I mean, is there a demand from informal workers to actually access to this information? And the second one is, how does your business model works? How are you sustainable?
Great. Should I answer or should I just take the input for now?
I think you can just take the input and then maybe provide the answer on the chat, if that's okay.
Great, thanks.
Thank you so much for for that, Sebastian. So next up, we'll be hearing from Fiorella.
Hello, my name is Fiorella Krapp, and I am a Peruvian infectious diseases doctor. Unfortunately, Peru has the highest coronavirus death rate worldwide. This is in part because we fell into a downward spiral, with our primary care system shut down and our hospital system collapsed. Medical care was reserved only for the sickest ones. Because of that, over 80% of our infected population had to stay home with minimal or no access to medical care, with no guidance on how to avoid spreading the virus at home or how to timely recognize severe disease. The numbers of infections and death continue to rise. Next, please. With this in mind, our multidisciplinary team blended medical knowledge with technology development, and we built a web-based system that could be rapidly implemented to monitor patients at home. Using artificial intelligence, we stratified patients based on their risk factors. Patients with no risks are followed by a chatbot on a daily basis. Patients with risk factors are directly contacted by doctors through daily phone calls made from a web platform that can be accessed from any computer or a tablet. This last feature was made keeping in mind that over 30% of doctors in Peru had to stay home during the pandemic because of their age or because of their risk factors. So we wanted to restore their ability to help. Our idea, next please, was put to test. We implemented our system at a public hospital located in one of the hardest hit areas in Lima. With a team of only 8 home-based medical doctors, we conducted over 4,500 medical attentions and reached over 900 patients and their families. Next, please. As a doctor, I strongly believe that providing timely and close medical care is crucial to contain COVID-19 and to save lives. We can provide that type of care to any patient with a cell phone with this system. Moreover, this system has the potential to adapt to address other health challenges that could benefit from frequent monitoring. By engaging public and private investors, we expect to make this a reality. Thank you.
Thank you so much for that. I think we'll hear an insight or two from Luisa.
Fiorella, it's a pleasure to have you. One of our dreams was to actually have scientists and doctors join us in this effort, and this is an incredible response to the system complexity of this challenge. I think for this to scale, partnerships with the public healthcare sector and or private healthcare providers will be key. So I'm curious, beyond this one partnership that you have with the public hospital, what are your plans to scale? And are you focused on public health, or are you also thinking about private partnerships?
Yes, thank you for the question. We have been exploring alternatives to scale. We want to try to provide this tool basically to public hospitals because we feel that they need this the most. Regionally, the health systems are also doing follow-up of patients in a very artisanal way. So we really think that they could benefit on adopting this system. So that's some of the stakeholders that we have been contacting are basically health authorities at regional levels, and they have shown a lot of interest on acquiring this type of system.
Okay, thank you so much, Fiorella. And I know there could be other additional questions, so let's continue the conversations in the chat, but really thank you for also shedding more light with regard to that question. So last but not least, we'll be hearing from David, all the way from Ethiopia.
Hi, can everybody hear me?
Yes, we can.
Great. Okay, so do you like having fun and playing games? Can you remember a game you have played before? Perhaps school yourself. You remember it because you either won or you lost, and so it carries a deeper weight in your heart than other memories. This is the power of games. My name is David, and I'm the General Manager of Desert Rose Consultancy in Ethiopia. We love games at Desert Rose, so much so that we design and make our own. Each of our games teach life skills or behaviors to improve people's lives, their health, and their prosperity. Next slide, please. Do you want children to have fun at the same time as learning skills that could save their lives and the lives of their friends and family around them? Within 15 minutes of playing our hand hygiene game called Endord, players know the importance of regularly washing their hands and using a face mask. We designed and manufactured this game in Ethiopia. Ethiopia has over 80 languages and unique cultures, so we made sure that the messages could cross these boundaries and still be understood. It works for children, teenagers, adults, or elders. We've played it in hotels, in schools, cafes, even gas stations and under trees all over Ethiopia, each time making iterative changes and improvements to the gameplay and design based on the feedback that we got. Children began to police and influence their own parents' and families' behaviors, spreading the healthy hand hygiene practices further to those more vulnerable through age. In essence, the game is a trade-off between small sacrifices for hygiene versus large benefits in health and security. Once we had a classroom full of children watching as a big 16-year-old boy went for the fast, unhygienic route through the game and not bothering to wash his hands at all. When he got exposed just a field before the finish, he had to start all over again, and he was so frustrated he leapt up and almost stormed out of the room. Fortunately, his friends helped him see the funny side, but that day, everybody in the classroom went home knowing that their attitude towards something as simple as washing hands had completely changed, teachers and pupils alike. Next slide. The world wants to get their schools back as safely and as soon as possible. Parents need to return to work and revive the economy, as well as their own income. Our game can help with both of these goals. Healthy children can attend school. Parents with kids in school can return to work. Our plan is to tailor the gameplay towards COVID-19 specifically and transition the game from a board game into an outdoor game that enables physical distancing and lets children themselves move physically through the game map, thereby enhancing the learning effect. Next slide. We will first target specific communities in Addis Ababa, followed by expansion across Ethiopia or even the Horn of Africa and beyond, protecting children and their families from the spread of COVID-19 through improved hand hygiene. Do you still want children to have fun? Then please partner with us to bring fun and safety to thousands of children and their families. Thank you for listening.
Thank you so much, David, for the strong closing. And I think with that, we're going to be inviting Hector just for 1 minute of feedback.
Yes. In making the scalability of the game, which part is digitalization playing, David?
Sorry, do you mean as in, is it an online game?
No, given that it's not an online game, have you thought on making it digital and online to make it scalable?
Yeah, we have, but we haven't done any work to that length. But we certainly have had a lot of discussions in our team about how that would be really cool. But unfortunately, it's not a skill set we currently have in our team to push forward. We would love to talk with app developers and others interested who hopefully would have those skill sets. That would be really exciting for us.
Thank you so much, David, and also thank you so much, Hector, for closing us off. So we have come to the end of our winning pitch presentation. A big, big, big congratulations to all the 10 teams for having put in the work to share the innovation with all of us, and for each one of you for showing up, for providing feedback, for listening keenly, and providing all the support that you look. And lastly, we also want to really extend our thank you to our experts and insights through that. So we really encourage you to, again, head over to the networking tables and use that time to interact deeper with all the innovators or with all the attendees that have joined across the world, and just joining in and keeping the community going. Again, thank you so much for joining, and we look forward to interacting with you more in the networking tables. That's it from my end, and please take care.